Dr. Rizwana Parveen to deliver her flash talk on cervical spine orthosis. So many a time we come across patients with neck pain, and we have to prescribe cervical spine orthosis. In whom to prescribe, what to prescribe will be covered by this talk.
Good afternoon, everyone. My topic is cervical orthosis. I am Dr. Rizwana Parveen, Senior Resident, Department of PMR, CNMCH. And functional biomechanics, at first we have to know the functional biomechanics of the cervical spine before prescribing the cervical orthosis. This is the 3-column load sharing model like vertebra, disc and facet joints. Coupled motion patterns important for orthotic restriction. Orthosis aim to reduce flexion, extension, rotation, lateral bending. Key goals is to stabilize, reduce micromotion and offload the painful structures. Clinical indication for cervical orthosis like trauma, postoperative stabilization, degenerative cervical myelopathy or radiculopathy, rheumatoid arthritis at atlanto-occipital instability, acute soft tissue injury or neuromuscular weakness. Classification of cervical orthosis like soft cervical collar, rigid cervical orthosis, cervicothoracic orthosis, halo vest and custom 3D printed orthosis. Soft cervical collar, primarily proprioceptive and heat retentive effects. Motion restriction is very minimal, used for short-term pain reduction, and risk of prolonged use is deconditioning, altered proprioception. And this is soft cervical collar. Nowadays it is used as a ornament. And then comes to rigid orthosis, like it causes motion restriction. Among the rigid orthosis, Philadelphia, this cause moderate restriction in flexion and extension. Miami orthosis improves restriction of rotation and stabilization. Aspen is there, enhanced comfort and pressure distribution. And there is evidence of no rigid collar limits all the planes fully and also critical for counseling. And these are the Philadelphia collar and Miami collar. And cervicothoracic orthosis, there is Minerva base, SOMI brace, and their indication is unstable cervical injury post-op stabilization. There is SOMI and Minerva. SOMI causes atlanto-occipital restriction. Halo vest, then comes the halo vest, gold standard for maximal immobilization. Pin site complication is there like infection, and this is the halo vest. It causes the pin site in complication like infection, loosening, psychological impact like sleep disturbance, anxiety, requires strict multidisciplinary modification. And here is the soft cervical collar, Philadelphia collar, Miami, Minerva, SOMI, halo vest and custom 3D printed cervicothoracic orthosis. There is comparison like flexion extension restriction, lateral bending restriction, rotation restriction and overall support. Like soft cervical collar gives minimal support, Philadelphia, Miami gives moderate support, Minerva gives high support and SOMI gives high support on flexion and extension. Halo vest gives the maximal support. And custom 3D printed cervicothoracic orthosis gives high support. Clinical decision making algorithm like determine the instability, first stable versus unstable, identify the plane of motion requiring restriction, evaluate the patient tolerance, skin integrity and cognition, match the orthosis to desired biomechanical control, and then reassess regularly for complication. Comparative evidence like rigid collars superior to soft cervical collar for motion restriction. No robust evidence for soft cervical collar in whiplash recovery. Halo versus Minerva, halo superior for C1, C2 instability, and CTOs are better, cervicothoracic orthosis are better than rigid collars for lower cervical stabilization. Complication and risk management, skin breakdown is there, dysphagia with rigid collars is there, respiratory insufficiency in neuromuscular patients, and psychological burden is there like claustrophobia, anxiety and all. Rehabilitation with cervical orthosis, early mobilization protocol must be maintained, respiratory training if thoracic components is involved, education on activity on daily life modification and collar hygiene should be maintained. Proprioceptive retraining post-weaning is compulsory. Gradual cervical strengthening and isometric exercise must be there. Emerging technologies like 3D printed custom cervical orthosis. This is a smart orthosis. Integration of neuromuscular stimulation is there. Material carbon fiber and composite for weight reduction. Summary: the collars and CTO are for higher stability needs. Halo remains the gold standard for maximal control, and rehabilitation essential to avoid deconditioning. Future is personalized, lightweight, sensible device should be there. Thank you.
Thank you, Dr. Rejwana. Any question?
In the spasmodic torticollis, whether you will use cervical collar, if you use, you see which type.
In cervical, spasmodic torticollis, we can give soft cervical collar, but not other cervical collar. There should be like medications and physical therapy should be there.
Okay then. Thank you, Rejwana.
Thank you, sir.